everybody. Today I'll talk about the main organ of the cardiovascular system, which is the heart. First, we'll talk about the location and external features of the heart. That means where the heart is located inside your body and the structures you can see from outside. Then we will talk about the layers in the wall of the heart. There are 3 layers in the wall of the heart. We will talk about those layers. Then we will talk about the properties of the cardiac tissue. There are 2 types of properties. Anatomical, that means the structural. If you see under the microscope which structures you should be able to see. So those are the anatomical properties, and physiological or functional properties are another type of properties of the heart muscle tissue or cardiac muscle tissue. Then we will talk about the sulci and the thickness of the wall in different chambers of the heart. We'll talk about inside the heart, the structures inside the heart, for example the valves and other structures. We'll talk about the coronary circulation. Coronary circulation is the heart's own circulation. Heart circulates blood throughout the body. However, heart itself needs its own circulation to keep the heart tissue or cardiac tissue alive. So, heart itself has its own blood vessels, arteries and veins. Those are to provide oxygen and nutrients to the heart tissue, muscle tissue, and take the carbon dioxide and metabolic wastes out. Then we'll talk about few clinical conditions. So you know that cardiovascular system consists of heart, blood vessels, and the blood inside the heart and the blood vessels. We talked about it in last lecture. So we are going to talk about the heart. Heart is the only one in your body, right? Blood vessels are many. There are 3 types of blood vessels: arteries, many veins, many capillaries. And the blood circulates inside the heart and the blood vessels. Okay, so the heart is located inside the thoracic cavity between the 2 lungs. So if you see the thoracic cavity, which is above the diaphragm, you know from NP1 the body cavities, right? This is the diaphragm inside your body, and above the diaphragm this is the thoracic cavity, and below the diaphragm this is the abdominal or abdominopelvic cavity. Okay, so the heart is located in the thoracic cavity between 2 lungs. So if you see 2 lungs like this, this is the right lung, this is the left lung, and your heart is in between these 2 lungs. Okay, and the space between the 2 lungs is called the mediastinum. So this space inside the thoracic cavity between the 2 lungs is called the mediastinum. Now if we divide the mediastinum into upper and lower parts, this is the upper mediastinum This is the lower mediastinum, and you see your heart is located in the lower mediastinum between the two lungs. Heart rests on the diaphragm, sitting on the diaphragm, attached strongly to the diaphragm. And now if I see the midline, I'll see that the most part, about 2/3 part of your heart is located in the left side, and only 1/3 is located in the right side. So this is the right part of the thoracic cavity, this is the left half, and you see if this is the midline, 2/3, that means most part of the heart is located in the left side of the thoracic cavity, and only about 1/3 part is located in the right side of the thoracic cavity. Okay, so that's why we say heart is located in the left side of the body. So most part of it is in the left side. Now you know that in your chest you have the ribs, right? In both sides you have the ribs, 12 pairs. So if I want to locate the position of the heart from outside, by counting the ribs I can locate the heart. So heart is located between the second and fifth intercostal. Inter means in between, costal means ribs. So between the ribs, second and fifth spaces, intercostal spaces. So if this is your first rib, this is your first rib here, this is the second rib. So this space is the first intercostal space between first and second. Now you see this is the third rib. So between second and third, this is the second intercostal space. So the upper border of the heart you see here is in the second intercostal space. And same way, if we count the ribs and go down, the lower end or bottom of the heart is located in the fifth intercostal space. That means between the fifth and sixth ribs. This is the fifth intercostal space. So from outside, by pressing on the chest wall, you can count the rib and can locate the position of the heart inside your thoracic cavity between second and fifth intercostal spaces. Okay, and cardio surgeons, they before they open the chest for surgery, they would locate the heart from outside. That is called the surface anatomy. Okay, so that is the location of the heart. The shape of the heart is cone shaped, conical shape, and the size is like the size of your fist. When you close your hand, the fist, that's the size of the human heart. Orientation to the heart, as I mentioned, shape is cone shaped, and if you see the heart has a base and an apex. The lower pointed part, which is in the lower left corner, that is called the apex. So lower left pointed part is called the apex. Okay, this is the left side, this is the right side. Okay, so now if I divide the heart into 4 chambers, heart has 4 chambers. Upper 2 chambers are atria, Atria is plural, atrium is singular. So this is the right atrium, this is the left atrium, this is the right ventricle, this is the left ventricle. So you see the apex is actually in the left ventricle, and the base is this part where the large blood vessels are attached. You know that the large blood vessels either take the blood out from the heart or bring the blood into the heart. From the heart, oxygenated blood should go to the body and deoxygenated blood should come back from the body. And also from the heart, deoxygenated blood should go to the lung and oxygenated blood should return from the lung. So two types of circulation, systemic and pulmonary. In systemic circulation, heart sends oxygenated blood to the body and veins bring the deoxygenated blood back from the body. So between the heart and the body, that is systemic. In pulmonary circulation, heart sends deoxygenated blood to the lung because lung will give oxygen to the blood, right? And after the blood gets oxygenated, that oxygenated blood returns to the heart. So just opposite of systemic circulation. In systemic, oxygenated gets out to the body. In pulmonary, deoxygenated gets out from the heart to the lung. So this part where the large blood vessels are attached is called the base. Okay. Here in this picture you see two lungs are located inside the pleural cavities. So this is the right lung and this is the right pleural cavity here, and this is the left lung located inside the left pleural cavities. So between two lungs, that means between two pleural cavities, you have this space here. This space is called the mediastinum, you remember I mentioned. And if I divide this space between the two lungs into upper and lower part, that means this is the lower mediastinum, this is the upper mediastinum. So heart is located in the lower mediastinum, attached to the diaphragm. This is the diaphragm. Okay, and so this is the diaphragm, this is a muscle, and heart is just sitting on it. And upper mediastinum has those large blood vessels. So this part is the base, this is the pointed part, lower left is the apex. Okay, and this cavity is called the pericardial cavity, in which the heart is located in the lower mediastinum. So this is the pericardial cavity. So now we can say that heart is located in the lower mediastinum between two lungs or between two pleural cavities, and heart is inside the pleural pericardial cavity, rests on the diaphragm. It has a lower left pointed part which is called the apex, and upper part where the large blood vessels are attached is the base. And it has four chambers. Upper two are the atria, lower two are the ventricles. Here you see this is the, if I draw the midline, this is the sternum, right? So you see most part is in the left side, only small part is in the right side of the thoracic cavity. And this is the fifth intercostal space, you see, between fifth rib and sixth rib. So the lower border is here and upper is second intercostal space between second and third ribs. Okay, so heart has two atria up right and left, and two ventricles. Upper two are atria, lower two are ventricles. Now, if you see the wall of the heart has three layers. Okay, three layers. So this is inside the heart. Okay, and this is left ventricle, right ventricle, right atrium, left atrium. And if you see the wall of the heart, the ventricular wall is thicker than the atrial wall. Atrial wall is actually much thinner than the ventricular wall. So if you see the atrial wall, it is thin, and the ventricular wall is thick. The reason is atria send the blood just to the ventricles. That is the function. Atria contract and send the blood to the lower ventricles. So not too far, right? From the atria, blood goes to the respective ventricles, just below them. And weak contraction is enough to just open the valves and send the blood from the atrium to the ventricle. And gravitational force will also work here. So atrial wall is thin because it doesn't need to create a lot of force. It doesn't need a lot of muscle to contract forcefully. However, ventricles do what? Send the blood to the outside of the heart. Right ventricle sends the blood to the lung, and left ventricle sends the blood to the body. So you see, the ventricles, both ventricles are sending the blood to the outside. So they need to contract more forcefully. That's why ventricular wall is thicker than or healthier than the atrial wall. Now, if we compare the right ventricular wall and left ventricular wall, left is thicker than the right. Why? Because just think that left ventricles contracts to send the blood to the body everywhere, so far from the heart, to your head, to your leg, right? Distal parts of the body too. So it needs to contract more forcefully than the right ventricle, because right ventricle sends the blood where? To the lungs, and lungs are just next to the heart, right? So not too far. So that's why left ventricular wall is much thicker than the right ventricular wall. Now if I want to see the layers in the wall of the ventricle, I will find that it has three layers in it. Okay, so what are those three layers? The outermost thin layer, which is like a membrane, is called the epicardium, and then middle thick layer is called the myocardium. So this is epi, which is just the covering, epicardium. Then middle thick muscular layer is the myocardium. Myo means muscle. Myocardium, muscular layer. This is actually the cardiac muscle, and contraction is given by this muscle, the pumping action of the heart to move the blood. And then innermost layer is again very thin layer, that is the endo. Endo means inside, right? Endocardium. endocardium. Okay, so those are the three layers: outermost epicardium, middle thick layer is the myocardium, and innermost thin layer is the endocardium. Okay, and the contraction is given by the myocardium, the middle thick layer. Epicardium is actually the covering for protection, and then the endocardium is a thin layer just to make the inner surface smooth. So when the blood will flow, it will not cause friction, or it will not get slow. So endocardium makes the inner surface of the cavity smooth for a smooth blood flow. Okay, now if inflammation occurs in the endocardium, that is called endocarditis. Itis is the inflammation. You can just add itis to anything, and for example meningitis, tonsillitis, right? Pharyngitis, pleuritis, nephritis, hepatitis, we use many. So itis is the inflammation of that organ or part of the body. So now if I use the term endocarditis, you see itis, where endocardium, that means innermost layer inflammation. Myocarditis, you will feel pain because this is muscle, and if inflammation occurs in the muscle, that is myocarditis, another clinical condition. Okay, now if I see the pericardial cavity, you remember I mentioned that heart is located in between the two lungs in the lower mediastinum and where in the pericardial cavity. So this is the heart again, and now I'll show you the covering of the heart. Okay, so the covering of the heart is called the pericardium, and it has two layers. So it is a double layered membranous structure. Okay, so you see here, this is the inner layer of the pericardium, which is attached to the surface of the heart, and actually this one makes the epicardium, the outermost thin layer of the wall of the heart that I just mentioned. Okay, and then what happens, you see, it gets folded like this and forms the outer layer. So this is the outer layer and joins like this. So it is like if you take a balloon and press your fist on it, around your fist, the balloon will form two layers, right? The one is attached to your hand, and then the air, then the outer layer. So this is the outer layer of pericardium, and this is the inner layer of the pericardium, right? So outer layer is called the parietal layer, and inner layer is called the visceral layer of pericardium. Make sense? So we can say that the epicardium, which is the outermost layer of the wall of the heart, is actually the visceral layer of pericardium, right? Then you have the thick middle layer, that is the myocardium, the muscle gives the contraction. Remember I showed you in last slide. So this is the myocardium, and then innermost thin layer which actually makes the surface smooth, that is the endocardium. Okay, so now this cavity is called the pericardial cavity, in which the heart is located. So inside the pericardial layers you have the cavity, and now if you see the space between the parietal and visceral layers, this space is called the pericardial space. Pericardial space. And in this space you have small amount of fluid, not fully filled. There is some fluid inside the pericardial space, and this fluid is like oil, lubricating fluid. Okay, and when the heart contracts and relaxes, is these two layers, the outer and inner layers, move in opposite direction. If there is no fluid in between these two layers of pericardium, then what will happen? Friction will occur between these two layers. Rubbing will cause sharp pain during the contraction and relaxation of the heart, because they move in opposite direction. And this fluid, the lubricating fluid, is called the pericardial fluid. Pericardial fluid, it prevents the friction. Make sense? It's a lubricating type fluid, but it is not fully occupying this space. It's partially filling this pericardial space. Now if inflammation occurs in the pericardium, these layers, that is called pericarditis. Again itis, right? Pericarditis, commonly heard. Pericarditis is the inflammation of the pericardium, these layers. And when pericarditis occurs, what can happen? The two layers, the fluid can get bad, and two layers may get attached to each other and rub each other, and that will cause sharp pain. Okay, so that is a clinical condition, pericarditis, and it causes pain because the two layers, friction between two layers. Now there is another clinical condition in which the fluid accumulates in the pericardial space between these two layers. If too much, you remember I said it is partially filled with lubricating fluid, pericardial fluid. However, if too much fluid accumulates here, then what will happen? The pressure will increase in the pericardial space. Increase pressure around the heart, right? So heart will not be able to expand, and that clinical condition is called tamponade. Okay, so heart cannot relax or expand fully. So again, quickly let me make it clear, two layers of the pericardium, right? Outer is the parietal layer, inner is the visceral layer. Visceral layer forms the outermost layer of the heart, which is the epicardium, and this space, whole space, is called the pericardial cavity, in which the heart is located, right? And this space between these two layers is called the pericardial space. So this is the pericardial cavity, this is the pericardial space, and it is partially filled with that fluid. Okay. Here you see the layers in the wall of the heart. So if you see the outermost layer, this one, this is the outermost layer, and this is the epicardium. Okay, and then this is middle thick layer, this is the myocardium, cardiac muscle, and this is the innermost thin layer again, that's the endocardium. Okay, so just to know that those are the three layers. Okay, now the properties of the cardiac muscle. You remember at the beginning I mentioned there are two types of properties, anatomical properties and physiological properties. Here we will see the anatomical properties. So if you see the cardiac muscle, the muscle fibers here you see are cylindrical fibers like this. Cylindrical fibers, and the fibers are attached to each other by thick bands. These are called the intercalated discs. Intercalated discs. Okay, and this is one fiber cylindrical, this is another fiber between the intercalated discs. Okay, and this is another fiber, and they are side by side, and they are sometimes you'll see they are connected by branches like this. So branching, right, is present in the cardiac muscle tissue if you see under the microscope, and usually we see one nucleus in each fiber. However, sometimes there could be two, but usually one, but sometimes you can see more than one, two, but not more than two. And also inside the fiber you'll see thin lines, not thick lines are intercalated discs between the fibers. So this is intercalated disc, but this inside the fiber you'll see thin striations or lines. Okay, so striations. Okay, if you see these structures under the microscope, this is the cardiac muscle tissue. Okay, and these are the properties of the cardiac muscle tissue. Now here you see intercalated discs. These are the intercalated discs, and you see here the fade bands or lines. These are striations. Okay, and nucleus, and here you can see the branching. Okay, so those are the properties, anatomical properties of the cardiac muscle tissue. Now, why intercalated discs are important? If you see an intercalated disc, the structure in the intercalated disc, you have the intercellular junctions. Okay, intercellular junctions. Now if I see an intercalated disc, I will see this is one fiber, this is another, and this is the intercalated disc, I will see many gap junctions, that means open pores in it. Okay, and also I will see very strong junctions, they hold the fibers together. So two types of junctions. One type are the gap junctions, so the fluid can easily go from one fiber to another because these pores are always open. Make sense? So if any ionic changes occur here, then it will quickly go to this side too. So the ions can move from one fiber to the next through the intercalated discs. So the fibers of cardiac muscle tissue can talk to each other quickly, right? Communicate quickly each other because these doors are open. And then these are very strong attachments. These are called the desmosomes. Okay, so remember, desmosomes hold the fibers very strongly together, and gap junctions allow the ions to quickly move from one fiber to another. So these are two types of junctions we see in the intercalated disc, and because of these two types of junctions, the cells are very strongly connected to each other, right? If one muscle fiber or cell contracts, then another will also be pulled because they are strongly attached by desmosomes. Okay, and they can also talk to exchange the chemicals or ions quickly, so they can talk to each other quickly, communicate quickly. So that's why cardiac muscle is considered as or termed as syncytium. The term syncytium means whole, together, or a single unit, whole unit. That means all muscle fibers can work together because of these two types of junctions in the intercalated disc. Make sense? So which is very important because you know that all cardiac muscle fibers must contract, must work together, respond together to cause forceful contraction. Okay. Cardiac muscle tissue continuously needs oxygen supply as well as nutrition for metabolism, because you know that heart is the organ which is continuously working throughout the life, right? No rest. If your heart rests, then you know what can happen, right? So no rest, it is contracting and relaxing, pumping 24 hours throughout the life. Even when you are sleeping, your heart is working same way, right? So it needs continuous supply and a lot of oxygen and nutrients. When you sleep, other organs come down, but heart cannot do that. Okay, so we talked about the pericardium and pericardial space. Here you see I said that balloon, if you press your fist on it, it will look like this, right? And this is the outer layer, this is the inner layer attached to your fist. This is considered, if you consider this is your heart, so this is the visceral layer, forms the outermost layer of the heart wall. This is the parietal layer, and the space, it has fluid, but partially fluid filled, and also has air in it. Okay, how much fluid can be in the pericardial space, about 10 to 15 milliliter. Okay, we talked about the pericarditis, also myocarditis, endocarditis, right, and tamponade. Those are few clinical conditions. Now, the external features of the heart. If you see the heart from outside, you can see this is the front view. So this is the apex again. This part is the base of the heart where the large blood vessels are attached, and you can see the fat tissue attached to the wall of the heart. And actually the fat tissue is accumulated inside the grooves. That means the outer surface of your heart, you have shallow grooves, elongated grooves, and the fat accumulates inside the grooves. So this is one groove here. You cannot see the groove because it is filled with the fat, yellow fat, and also here you have the groove right in the front, but also you have in the back. So we'll talk about this. And this is the pericardial space, this is the parietal layer, this is the visceral layer. Okay, and you remember I mentioned that the bottom of the heart is strongly attached to the diaphragm by the fibrous tissue. Okay, okay, the grooves are sulci. Those grooves are called sulci. Now, if I want to say only one groove, indicate one groove, that is called a sulcus. Sulcus is singular, and the term sulci, some people say sulci, sulci indicates more than one. Okay, so that's the only difference. Okay, so if you see the heart from outside, you will see anterior and posterior interventricular sulci or grooves. That means in between the ventricles, interventricular. How many? Two. One is in the front between right and left ventricles, another is in the back between the right and left ventricles. Okay, so those two, interventricular. And there is another sulcus that is called the coronary sulcus. Coronary sulcus. I will say sulcus because only one, right? And in the coronary sulcus, you have a short vein that is called the coronary sinus. So remember, sulcus is the groove, coronary sulcus, and inside that groove you have a short wide vein, short and wide vein, that is called the coronary sinus. So let me draw here, that will make it easy. Okay, so you already know upper two chambers, atria, and lower two ventricles, right? So this is left ventricle, this is right ventricle, and you have a groove here. This is the front view. Okay, so this is the anterior interventricular sulcus. Makes sense? And in the back, if you see, you have similar sulcus between right and left ventricles, that is called the posterior interventricular sulcus. Now, where is the coronary sulcus? Between two atria and two ventricles, this way. The direction is this way. Okay, transverse, and it goes all the way around, so you clearly see in the back too. Okay, and in the back part, you remember I said there is a short wide vein in the coronary sulcus, not everywhere, only in the back part. Like if you see the back, you'll see a short vein, that is the coronary sulcus. Okay, the coronary sinus. Sinus is the vein. And in anterior and posterior interventricular sulci, you have anterior interventricular artery and posterior interventricular artery. So easy names, right? Okay. Ligamentum arteriosum, it is a ligament, fibrous tissue structure that connects the pulmonary trunk and aorta, those two blood vessels that are attached to the heart. And in early life, actually, this was an artery that is called the ligamentum arteriosum. Is the structure here, you see. This is the ligamentum arteriosum. It is a fibrous, you see, tissue structure that connects the pulmonary trunk and the aorta. However, in fetal life, it was an artery, okay, and the blood from the aorta could easily enter into the pulmonary trunk, or pulmonary trunk, it can easily go to the aorta. However, in later period of your fetal life, it gradually shrinks and becomes a ligament, no more artery. Okay. Here you see, this is the pulmonary trunk here, and this is the aorta, ligamentum arteriosum. In fetal life, just remember, it remains open like an artery, and then it gets closed and stays as a fibrous tissue structure, no function. Now you see, this is the back of the heart, right? So in the back, you see again posterior interventricular sulcus, right? Left ventricle, right ventricle. So interventricular sulcus, where you have fat, as I mentioned before, as well as you have the artery. That's the posterior interventricular artery in posterior interventricular sulcus, and also a vein. So in the interventricular sulcus, both in anterior, this is the anterior, and you see fat and artery and vein. Also in the posterior, you have fat and artery and vein. And this is the back part of the coronary sulcus. Okay. Also it has fat and blood vessels in the coronary sulcus, right? Between atria and ventricles. And this short, wide vein is called the coronary sinus that I mentioned before. Okay. Coronary sinus is important because most of the veins, you see, this is called the great cardiac vein, this one, this vein, most of the veins of the wall of the heart give blood to, or drain blood to, the coronary sinus. That's why it is wide, because it receives blood from almost all the small veins that bring the blood, deoxygenated blood, from the wall of the heart or heart muscle. Coronary circulation is the circulation that gives oxygen and nutrition to the wall of the heart. Heart sends blood to the body, right? But heart needs its own circulation for its own tissue, cardiac muscle, and that is the coronary circulation. So these are the small blood vessels. Okay, see, this is the heart, and the large blood vessels that take the blood out or bring the blood in, attached to the base of the heart. However, if you see in the wall of the heart, you have a number of small arteries and veins for the cardiac muscle. So these are the coronary blood vessels, coronary arteries and veins in coronary circulation. So first we'll see the coronary arteries. The coronary arteries are right coronary artery, left coronary artery, marginal artery, circumflex artery, and two interventricular arteries. You remember in the interventricular sulci, anterior and posterior. So these are the important coronary arteries in coronary circulation. Okay, so they supply oxygen and nutrition to the cardiac muscle to keep it alive and functional. Now, also you have the veins, definitely, in the wall of the heart. We'll see the veins too. But first let's see the arteries in the picture. So this is the left coronary artery, you see here, and this is the right coronary artery, this one. So this is the left and this is the right, and both of them arise from the ascending aorta. This is the aorta, right? This is the ascending part. So they arise from the first part of the aorta, from the very beginning, right? Part of the aorta. This is the right coronary artery, starts here, and the left coronary artery comes out from here, from the very early part of the aorta, and takes the blood to the wall. Then the left coronary artery, you see, is kind of short, and it divides into a circumflex. This one, let me change the color. So this is the left coronary artery, and it divides into two here. You see, this is the circumflex. This one goes around the heart, goes to the back and circles around the heart, and this one is going down into the anterior interventricular sulcus. So that's why it is called anterior interventricular artery. Makes sense? And right coronary artery, this one, you see, gives branches. The important branches are called the marginal arteries. Okay. Now, if you see the arteries in the wall of the heart, arteries have two important properties. How the arteries in the wall of the heart are different than the other parts of the body. Those are the properties of coronary circulation. One is, let me draw here. If this is an artery, this is one artery in the wall of the heart, okay, and this is another artery in the wall of your heart. If you look those arteries in the wall of the heart, that means coronary arteries, you will see many collateral branches, like many branches from the sides arise like this. So number one important property is many collaterals. Makes sense? And another important property is these branches, you'll see, they get connected to each other by the anastomosis. So they get also connected by small branches. These are called what? Anastomosis connections. Anastomosis. anastomosis is singular since many anastomoses. If I say SIS, singular, one. If I just only indicate one, this is an anastomosis. Since there are many, we'll say anastomosis. Okay, so these are two important properties of the coronary circulation. Now, why? What's the significance or importance? Is now see if a block occurs here in this artery. So blood will not be able to go this way, right? Will not be able to go to these branches. However, you see, blood can find alternate route this way. Through the anastomosis will go to this artery. Through this way will go to this side. Right? Makes sense? So we'll still be able to provide blood supply to the tissue here. Otherwise, if you don't have this anastomosis, then the tissue here will die easily, right? So these are giving protections. The important veins in the wall of the heart or coronary circulation are great cardiac vein, anterior cardiac vein, also there are a few more, middle cardiac vein, posterior cardiac vein, small cardiac vein. So those are others. Okay, so these are, and of course the most of them supply blood to the coronary sinus. Remember that short wide vein I mentioned, located in the coronary sulcus in the back of the heart. Okay, so here you see they have shown the arteries here too. You can see the veins here. Okay, so great cardiac vein, you see this is the front view. Okay, anterior cardiac veins. Also you have other veins you can see in the back. You see here posterior cardiac vein, small cardiac vein, middle cardiac vein, right? Okay, so these are the other veins. This is the back of the heart. So now you can see this is the coronary sinus, the wide short part, and it receives blood from the great cardiac vein coming this way. Okay, this is the posterior cardiac vein, this one bringing blood into the coronary sinus. This is the middle cardiac vein, right? Small cardiac vein, all of them giving blood to the coronary sinus. Then coronary sinus gives blood to the right atrium here. Okay. Okay, now the partitions between the chambers, between two atria, the septum or partition is the interatrial septum, very simple, and between two ventricles, the septum or partition is the interventricular septum. Okay, so that's how the atria and ventricles are separated. Now, if you see inside the heart, you will be able to see those septum, and also you will be able to see the valves. There are 4 sets of valves, actually 2 sets of valves, 4 in number total. So each set has 2 valves. Okay, 2 atrioventricular valves and 2 semilunar, half moon lunar valves. The valves open in one direction. That means not both directions, only one way, door. So valves are like doors but open in one direction. Two AV valves or atrioventricular valves, make sense, between atrium and ventricle. So this is your right atrium, right ventricle, and your right AV valves or atrioventricular valves are here. And if you see right AV valve, it has three leaf-like structures called the cusps. Okay, that's why it is called a tricuspid. You see 1, 2, 3, tricuspid valve is the right one. And left AV valve here has two leaf-like structures. That's why it is called bicuspid. So tricuspid is the right and bicuspid is the left. And left bicuspid is also called mitral. So right and left. Right is tricuspid, left is bicuspid, and left is also called the mitral. This is more commonly used, right? Mitral valves. And semilunar valves, also two, right? One is pulmonary and another is aortic. Now their names are telling you where they are located. Aortic. You know that pulmonary trunk arises from the right ventricle, and the beginning of the pulmonary trunk you have the pulmonary semilunar, and aorta arises from the left ventricle, and at the beginning of the aorta you have aortic semilunar. So in the aorta you have aortic at the very beginning part, and in the pulmonary trunk you have the pulmonary semilunar valves. So now which way the valves open, let me just quickly mention. AV valves, both right and left, will move downwards, open downwards this way. So the blood will be able to go from the atrium to the ventricle of the same side. So respective ventricles. And so if when the ventricle contracts, these valves will get closed, but will not open other way, will not open upwards. So blood will not be able to go back to the atrium again. It should not, right? It should get out from the ventricle. So it will close. When the ventricle contracts, the valves, AV valves, will get closed. When atrium contracts, the AV valve gets opened to let the blood move downwards. So AV valves remain open downwards. And the semilunar valves, now you see when left ventricle contracts, the blood should enter into the aorta, should get out. So the aortic semilunar opens upwards, and pulmonary, when right ventricle contracts, pulmonary semilunar also open upwards to let the blood get out. Makes sense? But if the blood tries to get back, they will get closed. So one way. Semilunar opens upwards and AV opens downwards. Okay. And the heart sound that you hear is due to the closure of the valves. Closure of the valves. So when the valves get closed, after they get opened, when they get closed, you hear that sound. Okay. When AV valves get closed, you hear the first sound, lub, and when semilunar valves close, you hear the sound, second sound, dub. It's a lub dub sound. Okay. Okay, now if you see inside the heart, cut the heart and see inside, here this is the septum between two ventricles. So this is the interventricular septum, Here is, you have the interatrial septum, and these are the valves, AV valves. So this is left, this is right. You see both open downwards, and this is the pulmonary trunk, and near the starting or beginning of the pulmonary trunk, pulmonary semilunar, and aortic semilunar you don't see here because it is just behind the aorta, so it should be somewhere under this. Now you see that inside the heart you have few structures. Okay, you see these muscles, see this one, from where string-like structures, many string-like structures arise, and these muscles are called, like this one, these muscles are called the papillary muscles, and papillary muscles have these strings attached. These strings are called chordae tendineae. Okay, and the other ends of these strings are attached to the AV valves. So these strings will control how much the valves will open and close. Okay, so the strings are called the chordae tendineae. They basically are attached to the papillary muscle and AV valve. We already talked about the thickness of the wall of the chambers. The heart atrial wall is thinner than the ventricular wall, and left ventricular wall is thicker than the right ventricular wall, and I explained why. Here you can see in this cross section the valves. You can see all four valves, right? So this is bicuspid, two cusp, this is tricuspid, this is the right, this is the left, and these two are semilunar valves. Okay. Okay, so valvular problems. You probably have heard that heart valves have some diseases or clinical conditions. One is called valvular stenosis. It's a commonly heard stenosis. Stenosis simply indicates hardening and narrowing. Shrinking. Okay, so if the valves get hard and the space of blood flow gets narrow, that is the stenosis. Okay, and the valvular disease could be congenital, that means it's birth defect, or could develop due to some other after birth, due to some other reasons. For example, rheumatic fever. Probably you have heard. It happens more in kids. Rheumatic fever. Okay, young kids, they get more, and the rheumatic fever that can cause lesion of the valves. Okay, so that can cause the defect in the valve. So valvular defects could be congenital or after birth. Now when narrowing of the space occurs. So when the blood tries to move from one chamber to another, for example from the atrium to the ventricle, since the space is narrow, the blood will not be able to quickly move from one chamber to another. It will push the valves, and that will cause friction, and sound of that friction is called murmur. So murmur is the sound caused by the friction of the blood. Arterial sclerosis. It is a coronary artery disease. So let me just explain this quickly. So this is the wall of your heart, and this is an artery that is supplying blood to this part of the wall of the heart. Now you see, if the artery gets blocked partially, for example not completely but partial block, so what will happen? If it is partially blocked, some blood will still be able to reach here, right? Because the artery is not fully blocked, partially blocked. So less blood will go here, insufficient blood, and that will cause pain in this area, and that is called angina. Angina means pain. Pectoris. Pectoris means chest. You remember pectoral muscles, chest muscles. So angina pectoris is the chest pain. Okay. But if it is completely blocked, then what will happen? The heart muscle will not get blood at all. If that happens, the tissue will die. If that happens, if the tissue dies, that is termed as myocardial infarction. Myocardial infarction, or MI. Commonly, clinicians, they use MI, myocardial infarction, which is also known as more commonly heart attack. Makes sense, right? So if the tissue dies, scar tissue is formed later, and that is MI. If MI is big, if large coronary artery is blocked, then the heart attack will be more serious and the patient may die immediately. Okay, but angina pectoris is not complete blockage. So if you take the medicine, you will see the patients take the medicine called nitroglycerin under the tongue, sublingual, and that will dilate the artery, so more blood will reach to this area and the pain will be relieved or will be gone. Now, what can cause the blockage? Sometimes, the fat plaques are formed, and if it is due to the accumulation of fat or cholesterol, that is called atherosclerosis. Sclerosis. Remember, atherosclerosis is the fat plaque that can block the artery. Okay. Now, if it is not due to directly from the fat, but the hardening of the wall and narrowing. Sometimes when we get old, usually this happens, the elasticity in the arterial wall is lost and the arteries get narrow, and the elastic tissue is lost, it becomes fibrous. So that narrowing is called, hardening and narrowing is called arterio. A little bit different, arteriosclerosis. Okay, arteriosclerosis. It usually happens in old age, or the people who smokes a lot, that can change the wall, smooth, elasticity of the wall, so the wall will be more stiff and narrow. So two different, slightly different names and different conditions, but both will do what? Reduce the blood flow, decrease the blood flow. Okay, so just go over the risk factors for those, and you see fat plaque deposition here, fat yellowish, that will narrow the arteries. Okay, so just go over these few. Ballooning, if the coronary artery gets narrow, you insert a tube. Usually we insert through the femoral artery and go all through the aorta to the coronary artery. You remember, coronary artery arises from the aorta, right? And then dilate that area of the coronary artery, that is called ballooning, and stent is another way to do that. Stent, so a mesh of like a tube-like structure, that, or ring like structure, that formed by fine mesh. Here you see the stent, tube-like or ring-like structure that will be implanted to keep the artery wide open. Okay, so that's all about the first part of